who in America is really concerned with Black women's ability to reproduce.
What is it about being a Black woman in the United States in particular that's not allowing us to have the same outcomes as women of other races?
My race, my gender, and how much I make directly affects the care that I receive.
It shouldn't take Serena Williams and Beyoncé talking about their experiences for folks to wake up and see that this is a public health crisis.
In this country, we should be able to live and not die because you can't afford health care.
So some of the diseases that affect the Black community more than other communities are definitely hypertension, which is high blood pressure, diabetes as well, and then certain types of cancer as well. We're talking about things like cervical cancer and breast cancer. And even in situations where the rates might be similar, Black women are definitely affected more or dying more from some of these cancers.
My most recent healthcare struggle has been with my fibroids. I found out about 2 years ago now that I had one small fibroid. A fibroid is an involuntary growth in your uterus that is typically benign, but can be anywhere from a centimeter big to the size of a grapefruit, the latter at which point can cause severe period problems and infertility issues.
I've been living with lupus for the past 9 years. Lupus is an autoimmune disease in which the immune system attacks healthy tissue and it inflames it. So lupus is a Black woman's disease. Black women and Hispanic women are 3 times more likely to be diagnosed with lupus than our Caucasian counterparts. And our community needs to know about it because it's sort of a creeper, right? It presents as other diseases, it presents as other, really mild conditions potentially, and it can be deadly.
For a long time, there was like this idea that I would read about online or talk about with friends about doctors think that Black women can take more pain, or doctors don't take Black women's threshold of pain seriously. And I found that to be true with the first 2 doctors, the white woman and the white male. They were both at the hospital that I went to when I had to go to the emergency room. And I'm telling them I'm in a lot of pain and I've been bleeding for 20 days and there's cartoon blink, no, that's normal, that's fine. And this sentiment that something that's clearly not normal is fine.
It's so unfortunate that in the United States, and we pride ourselves on being such an advanced nation, that Black women are still dying at 3 times the rate of white women in childbirth. And that crosses income, socioeconomic status, education status, age. It doesn't matter. It just means that Black women are dying in childbirth at alarming rates. And unfortunately, it shouldn't take Serena Williams and Beyoncé talking about their experiences for folks to wake up and see that this is a public health crisis.
The healthcare system at large is ignoring Black women's needs. I think that that's been said a million times by a bunch of different people. There's even this viral video on Facebook of a man literally pleading to the government, do something. Black women are dying, do something. And the fact that these sad stories have to be taken to the face of our government in order for someone to give a damn, I think that highlights pretty well that we're somewhere at the bottom of the totem pole in regards to our health needs.
The issue is I think we don't fully understand, to be honest, what exactly is going on. Because when you do look at women of the same socioeconomic status, there's still a difference between, say, Black women and white women in these mortality rates. So the question then becomes, is it cultural? Is it genetic? Even when you look at women of African origin or along the diaspora in other countries, the rates are not as bad as they are in the United States. So what is it about being a Black woman in the United States in particular that's causing this? And what other factors are happening that are not allowing us to have the same outcomes as women of other races?
I think healthcare is absolutely a racial justice issue and a social justice issue because my race, my gender, and how much I make directly affects the care that I receive. How much money you make isn't even an issue in this case with Black women and their fertility issues.
There are different factors that affect Black women that may be unique to the community, that are cultural, ethnic, socioeconomic, as I mentioned before. And one of the things that we know is even the most well-intended providers may still fall subject to stereotypes or other biases. And so one of the most important steps has to do with recognition of this and working to educate and train these providers that this exists and that it's affecting their ability to deliver effective care.
When we think about all of the barriers in accessing healthcare as a Black woman, when I think about the historical context that there have been abuses to our bodies, that we have not been part of the research when it comes to modern medicine, I think it's not necessarily that we need specialized care, we need more culturally competent care. But you also have to understand why there are significant barriers, whether it's the fact that research was provided on white male bodies versus testing everyone, when folks weren't listening to Black patients, when they were saying that this is what I'm experiencing. We have to change that now.
I'm starting to find that my body and a white woman's body don't need the same things. My baby and a white woman's baby don't need the same things. When I'm pregnant and a white woman is pregnant, we don't even take the same medicines sometimes, and that's like a real thing. Doctors, or at least the doctors that I've seen, it's almost like they're pointing out that the specialization needs to happen without doing it, because they're looking me in my face and going, this happens to Black women all the time, but that isn't being reflected in their day-to-day. If something is happening to Black women all the time, what are the doctors now doing special for the Black women?
Any new potential healthcare policies that come out of the new administration could be detrimental to people's health. It has already proven to be so. So, people are deciding to not purchase medications or skip their dosages because they can't afford the next month. If there are policies that roll back the protections for people with pre-existing conditions, you know how many people are not going to be on healthcare and who will just die? They will die. And that's a problem. And it's going to be lower income people, it's going to be middle class people who can't afford it otherwise. And it's just not right. In this country, we should be able to live and not die because you can't afford healthcare.
It is alarming that within all of these policies, the folks who have to lose are the ones that look like me and the ones that I will give birth to. And it's unfortunate that a lot of people who, quite frankly, can choose their doctors are trying to tell other people who they can and cannot go to for healthcare. And especially thinking about Black people fighting for agency over our bodies, not just in this country for over 400 years, but actually in this world, to have another interference for us to be able to have agency in picking and choosing what is happening to our bodies is a significant barrier.
I had a Black woman come in with back pain who every time she coughed, she would get chest pain. So I put an EKG on her, and every time she coughed, she had ST elevations. She was having a heart attack. So I called the cardiologist and I said, can you please cath this lady? And he refused to do the cath. And so finally I said, I don't want this woman to become a statistic that Black women get worse medical care around heart attacks because the medical institution doesn't listen to them. And he said, are you calling me a racist? And I said, well,
Who in America is really concerned with Black women's ability to reproduce? Whose priority is that outside of Black women and Black families? What white legislator is going to go to bat for Black women to have babies? Unfortunately, we need the powers that be in order to really affect the change. And I'm not sure what this looks like unless we do it ourselves.
I'm really try my best to inform other Black women. I've spoken or done a little tour around New York City with Black Health Matters and also with Lupus Research Alliance just to inform us about treatments, to inform us about getting diagnosed, and even clinical research, which I know that we are a little afraid of.
So there's not a lot of diversity in these clinical trials. There's not a lot of minority patients signing up for these trials and being willing to do these trials. So then the drug comes to market, and then we're dumbfounded as to why it's not working in our communities, but how would we know if they're not signing up for the studies? So I think it's important for physicians who have minority patients to push them to be in these trials, and for, as a community, us to be more willing to join them. And I get it. Again, there's a lot of mistrust around experimentation and what medication am I going to get, and is it going to be right, or are they just experimenting on us, in that sense of history, because it did happen. You know, it was many years ago, but it was real. So I get it. But if we don't put ourselves in these trials, then we're not going to know what works on us versus anybody else.
It's really important to talk to your family about healthcare history. Recent studies about preterm birth have suggested that if a woman's mother had a preterm birth, that she's more at risk for preterm birth. And so really understanding family history and family socioeconomic factors that are contributing are crucial to really getting the full picture of what might be happening in a woman's life and what might be the factors that are really affecting her.
I think that in the Black community, we kind of don't talk about what's wrong. You know, Black women, we're so strong, we push through pain, we push through discomfort, and once you figure it out, you kind of might close that up and hide that. I mean, even I, in the early stages of my diagnosis, I wasn't screaming from the rooftops. You know, I didn't know what that meant for my career. I didn't know what that really meant for my life. And so I kind of hoarded that information. But as soon as I started sharing, I found out 3 other people in my family had lupus. So why don't we know this? That's crazy, you know? And as Black families, we need to talk about what runs in our family, what diseases, what challenges, what anything. You know, that's mental health challenges. We need to know about those things so that we can treat them.
I definitely think on the healthcare provider side, we have to be even more diligent in making sure that Black women are being screened for these things. That's just like basic level. Just doing that, we could catch these things early, and maybe we could stop Black women from dying.